Actually, a story of success eliminating hepatitis C in less than 5 years. A story of success that had actually transcended borders, Dr. Anan. How can we share with our viewers, how did the road just start and where are we today?
Okay, and let me start with the same phrase. It's a story of success. And why it is a story of success? Because if we return back 5 years, we were talking about the country which was ranked #1 worldwide in terms of incidence and prevalence of chronic hepatitis, which is the disease coming from hepatitis C. So Egypt, unfortunately, was ranked #1. We had a very high prevalence. We were talking about 9% out of all adult population in Egypt suffering from hepatitis C virus, hence chronic hepatitis, which is the highest one. And we do have a high epidemiology and a high burden as well. The burden of hepatitis C is actually huge in terms of clinical burden. We are talking about a disease which is responsible mainly for liver cancer, responsible for cirrhosis, a lot and millions of mortality. And if we are comparing this worldwide, we do have 150 million global prevalence and around 1.5 million death mortality every year. So we are actually having a very high clinical burden. And we do have a lot of economic burden as well from hepatitis C. If we are talking economic, we are talking about most of the people suffering from chronic hepatitis unable to travel, for example, to work abroad. And because it's a silent disease, at the start, most of them, they discover they have chronic hepatitis during the travel visa and the working permit.
A bit of a tip to our viewers, since you've said, doctor, that it is a silent disease. How can we make it awake? How can we be awake to discover that it is there?
That's exactly 100 million healthy lives initiative, presidential initiative, which is to screen. The only way to eliminate chronic hepatitis is by screening, as there is no certain symptoms, especially if we are talking about the early phases of the disease that the patient can actually suffer from and then head to seek medical help or being diagnosed. So in 2018, Egypt launched the presidential initiative for 100 million healthy lives. And the main target was, as you mentioned exactly in the briefing introduction, is to eliminate chronic hepatitis. We do have a 62 million adult population in Egypt, and the objective was to screen them all. So in 18 months, it was planned for 3 years, but in 18 months, the country successfully screens 59 million. So almost all of the adult population were screened for chronic hepatitis, and it was ahead of schedule. The schedule was 3 years. They got it in 18 months. And we are talking about all governorates. You need to spread out all the diagnostic tools there. We are talking about doing PCRs, and if the patient is positive, we need to be sure and ready that we do have what it takes to treat. Because it's not only about screening. If you are screening 60 million citizens, you need to get ready because you will get millions of patients suffering from chronic hepatitis and millions of patients suffering from diabetes, hypertension, because the campaign was also screening for diabetes, hypertension, and dyslipidemia for lipid profile. So you need to make sure that you do have financial resources, which was actually secured for the campaign. You do have medical practitioners ready to treat, and you do have the medication itself. The medication, that was a success story on its own because we managed to get treatments about 1% of its global value. It's a 1%, this is not exaggeration. So we found by 2021, 1.5 million hepatitis C patients from the screening. So we are talking 1.5 million Egyptians were suffering from chronic hepatitis, and it was silent, they didn't know. They discovered during the screening. They were all treated, as we've seen in the reports, they were all treated for free by the liver cancer centers, liver centers, and we are talking about 98% cure rate, which is again ahead and above the global benchmarks. So that's very briefly what happened in the previous 3 years.
Yes, what happened is actually a story of success that we are really proud of, especially that it has transcended barriers, and this story of success has moved also to support our African brothers.
Yes.
So, here we have another impact and another dimension of the success story.
And we do have another presidential initiative because after 100 million healthy lives, Egypt launched as well 1 million African lives.
Yes.
It was a presidential initiative as well to treat 1 million African citizens from chronic hepatitis. And for the sub-Saharan countries and Western Africa, we sent the most important thing to send is the knowledge transfer. It's more important the screening tools than the treatment is how to run a successful screening. Because, by the way, we succeeded in doing a screening that was actually not successful in USA 2 times. We tried it in the 90s, we tried it in the early 20s, and it was not that successful. But by 2018, we discovered that in order to have a very successful screening, it shouldn't be all digitalized. It shouldn't all depend on digital platforms.
Yeah.
In Africa, we do have certain situations. We need to have an adapted tools and adapted techniques to run a successful screening. So this one is actually a hybrid between door-to-door visits, between doing invitations for rural countries and for rural areas and villages to have a one healthy days where they can go to the primary care and do the screening, where they can actually do educational campaigns, put booths in the sports club, for example. So the merge of all the tools all together in one campaign that was transferred as knowledge to the African countries, as well as, which is again a very important one as well, the medication which is locally manufactured. We manufactured all the chronic hepatitis C portfolio, the treatment itself, instead of having it all imported from abroad. So after Sovaldi was launched in the world, we managed to manufacture Sovaldi, which was a revolutionary treatment for chronic hepatitis in Egypt by 2 factories, local Egyptian factories, after exactly 6 months. It's another success.
Yes.
And currently we export not only to Africa, we export even to Europe. We do have another program for chronic hepatitis C management in Egypt for European citizens.
Yes,
so they come to Egypt for
3
treatment.
dimensions.
Yes, exactly.
Locally and from Egypt to Africa, and Egypt hand in hand with Europe.
Exactly, for medical tourism.
Yeah.
And promoting this, it comes as well for the economic aspect. So if we are talking economically, this campaign yielded a 359% return on investment. What does it mean? 359% return on investment.
What does those figures indicate?
It means that for each Egyptian pound we spent, because we spent billions, we got a return on the economy itself, for the Egyptian economy, 3.5 pounds. For each pound, you got 3.5 pounds. Why? Because we are talking about avoiding mortalities, avoiding late time treatment, and avoiding, which is very important, liver cancer. Most of liver cancer cases are from chronic hepatitis. So if we haven't made the campaign, we would have spent more than the campaign, 23 billion Egyptian pounds. So we saved the 23 billion Egyptian pounds because of the campaign. So we didn't spend money that, because all the time people are saying in 100 million healthy lives, we spent billions. We spent around 5 billion. So why you are spending 5 billion? Because we saved 23 billions.
So it had a positive impact on our
and
growth
that
rate.
was a good way as well to promote it outside of Egypt. So in order to talk with the African countries, you can take the medications, the knowledge transfer, and it will have good impact on the economy. So it's good for economy, trading, and as well for health. So the collaboration with Africa is our top priority country as objective as a country. And I believe the Healthy File can be a very good asset to strengthen this relation, because we are the oldest manufacturer of medication in Africa, and we produce 90% of our local needs. Africa, they produce 5%.
Yes.
So it's a great market for us to start collaborating.
A great market and a great project as well. We're talking about manufacturing medication. How about the vaccines? Manufacturing vaccines, which is also another important dimension here.
Yes, and maybe people, they know that we do have a medication, a good one for medication localization project, but we do have as well what we call the Vaccine City. Vaccine City was actually launched by President Sisi 2 years ago, and the main objective is to have an African hub for vaccine manufacturing. If we can remember back in COVID days, in Corona days, we were actually the first country to be able to make the technology transfer for Sinopharm, and then for the RNA vaccines, and then for AstraZeneca vaccines. So we do have a good platform for vaccine development. We do have a good minds that enable Egypt to have a good technology transfer. Technology transfer is not an easy process. We are talking about ready resources, we're talking about a lot of financials, and most important is a lot of standard operating procedures for factories, for plants, to be able to manufacture just one vial of vaccine that we are sure it's safe, effective, and efficacious for the disease they are actually protecting from. And currently, being said that after JAPCO and Vaccine City and all the local manufacturing, that we started the hub for mRNA vaccine as well in Egypt. This will be good for, as you mentioned, exporting to Africa, being hub for the pharmaceutical companies to manufacture their vaccine in Egypt. And needless to say that in Africa, we're #1 manufacturer of vaccines. In the Middle East and Africa, we're #2. So we can have the leadership easily by exporting. The next phase and what we must focus on is the new vaccines after COVID. We had the technology transfer for COVID. We can use the same platform, the same technology transfer for another and good and new and innovative vaccines that we can develop in the future for rotavirus, for whatever new viruses we can develop.
Definitely. We're talking about Egypt's efforts and the international community hand in hand, as Dr. Anan has emphasized. It's not only Africa, but also hand in hand with Europe, and we're going to be talking about this point, how it reflects also on the tourism file, how it reflects on branding Egypt globally. This in addition to eliminating hepatitis C by the year 2030. So we're working according to the international community plans. The target is in line with the United Nations Sustainable Development Goals. We're still talking tonight the health sector. We'll be talking also shortly AI and how it transforms the health sector generally, of course, all around the world, and how are we in Egypt prepared for such a revolution. So stay tuned, we'll be back.